Mount Sinai Health System is a truly extraordinary place with innovation and unrivaled educational experience for all of our trainees. The Department of Surgery has maintained surgical residency and fellowship programs for more than 150 years, educating the next generation of surgeons.
We are dedicated to training well-rounded fellows who are compassionate physicians and highly skilled in the surgical management of colon and rectal disease.
In this fellowship, you generally hit the ground running from day one. My first day, I actually ran my own clinic because you have a fellow-run clinic here. So day one, I was actually in clinic dealing with patients and deciding if they needed a surgical procedure.
Our colorectal faculty are committed to resident education and work closely with the fellow in both inpatient and outpatient setting.
Our program provides training in the full spectrum of colorectal disease, including rectal cancer with TATME and inflammatory bowel disease with a large volume of Crohn's disease and pelvic pouches for ulcerative colitis.
You want a fellowship that's going to prepare you well for the future and give you the support you need, and this is what Mount Sinai is. This program has everything. I wanted to go to a program that would train me in all aspects of colorectal surgery.
After graduating from the fellowship, a fellow will have mastered minimally invasive treatments and open treatments for colon and rectal surgery. They'll have mastered common anorectal pathologies such as hemorrhoids, fissures, fistulas. They'll also see more rare pathologies such as rectal prolapse and rectocele, and they'll see those treatments and will know how to deal with them as an attending.
Mount Sinai is a huge hospital system, and there's a lot of patients in New York City. And so you rotate at Mount Sinai West and then also the main Mount Sinai Hospital. You get to see different types of practices, different patient populations, so that when you're going out and practicing, you can figure out what works for you and what doesn't. And that's really what fellowship is about.
I think you could consider this fellowship to be very fellow-centric. The fellowship is very tailored to the fellow's interest. If a fellow feels like they missed out on something a little bit more in their residency and they want to gain from the fellowship, they can really pursue that. They can tailor the whole year around that, and the attendings are fully supportive.
While these are unusual times, trainees can be assured that the mentorship and education they received at Mount Sinai will be nothing short of outstanding.
I think this fellowship gives a very expansive experience, and I think that after the 12 months, I'm ready to go out into the world and begin my own practice.
When you finish your training here, you will be the best in the country.